project that I put forward for the award is called Talking About Your Medicines, and essentially it's a 1 hour drop-in clinic that happens on 2 of the AWA wards in Oxford, whereby service users can come in and book 10 to 20 minute one-to-one sessions with either a pharmacist or a medicines management technician. You might wonder what's so innovative and what's so different about this. Well, it was partially in response to our poor inpatient medicines related question results, and also because medication is one of the main interventions in many of the mental health illnesses that we see, and yet it's also one of the most contentious areas where the views of the medical team and the service user are at their greatest difference. But the NICE Medicines Adherence Guidelines suggest that 40% of medicine is not taken as prescribed. The organisation Rethink suggests in the mental health settings this might be closer to 50%. What this means for us is that £1.2 million a year is spent on drugs that are either not taken or not taken as prescribed. I felt that we needed a new, more collaborative approach to the dialogue about medications. We received training in motivational interviewing and cognitive behavioural therapy, and using the cornerstones of these techniques such as expressing empathy, collaborative working, Socratic method, reflective listening, we found that our interviews took on a fundamentally changed perspective. We were able to explore attitudes and experiences in a collaborative, non-threatening manner. In so doing, service users felt that they were heard and listened to about their medicines. To improve the efficiency of the clinic, where there was the odd occasion when service users didn't book up the complete hour, we opened up those extra sessions to ward staff, such that they may come and talk to the pharmacy team about any medicines related issue. On Vaughan Thomas, we integrated it with the Productive Series project, thus bringing 2 innovative ideas and enhancing both of them. But what about the all-important service user question? How did it affect them? With Sandra Parker from the Quality and Audit team, we produced a service user satisfaction survey. We piloted it, and the results of that were overwhelmingly positive. 100% of the respondents said that we answered their questions in a way that they could understand. 100% of the respondents said that they were treated with dignity and respect throughout the interview, and 100% of respondents said that they would recommend these sessions to fellow service users. Well, although this is a small project, it's a novel approach to communication in a contentious area. It's in line with the recovery model championed in the New Horizons initiative. It also empowers service users and gives them greater choice, which are key aspects in all of the NICE guidelines that we as a trust ought to be complying with. Winning would safeguard this project. Not only that, but it would allow it to expand for all service users to gain the benefit from.
The project we've set up is e-referrals. Over the last year we've been using lean principles to help us look at our processes, to help us eliminate time wastage and to deliver a safer and efficient service. We've found that when a GP referral comes in, it often doesn't give us the information we need to prioritise the referral, but also to act swiftly to support the client and their family. When we receive a GP referral, the duty worker often has to gather further information from the GP. This can often result in a delay depending on the GP's availability. What we would like to do is to communicate to the GP the information that we would like to have first time without any follow-up. We're trying to streamline the process by adapting our screening referral tool, which will then become our electronic referral. This will give us the information we need to process the referral without any delay. In addition, this will prevent duplication of work, so we won't have to put the referral onto the system a second time. I think our project actually addresses several of the main big issues facing OBMH at present. The Trust has invested in the Rio software and we're proposing to use it to the full. If we are able to implement e-referrals, we can then roll it out across the Trust, saving us a lot of time, duplication of work, but also reduce the number of complaints around lost referrals and clients being seen in a more timely manner. But most importantly, we want to ensure that any client referred to our team has a safe and efficient start to their journey through OBMH.
Our project is called the Cotswold House Electronic Communications Project, and it's got a number of strands which we developed for three main reasons. We're isolated from the rest of the Trust and from our sister unit in Oxford. Our patients come from a long way away and their families are therefore often very distant from them, and that also means that local teams with whom we have to communicate to make complex care plans and aftercare plans are also a long way away. There are various aspects to the project. One of the first we developed was telephone conferencing using the OBMH facility and a Polycom hub. This enables families and local teams to join CPAs without the need for costly travel. We've developed a video link now with Cotswold House Oxford, which is just being tested, which means that when I'm on leave, because I'm the only psychiatrist here, the psychiatrist covering from Oxford can see patients on the video link without having to travel here all the time. We're going to be testing a new video conferencing facility for small-scale meetings, which we hope will enable us to use it for management meetings, CPA meetings, but also for family therapy, where we use telephone conferencing, but actually being able to see people at the other end would be very helpful. We want to develop the website, and our patients themselves have many ideas about how the website could be developed to make it more attractive for potential referrers and for patients and for carers. And we use our ward mobile a lot for texting patients when they're on leave, but we also want to explore the use of Twitter for motivational messaging. This project is really important for us because we see it as a way of driving up quality of care for our patients and their carers at the same time as reducing costs and reducing non-productive time spent in travelling and arranging meetings. It's a very inclusive project. We've got a support worker who's interested in the Facebook angle, another support worker who wants to do web design with the patients. Patients and carers have been involved.
The community map is a computer-based database of all the socially inclusive organisations and activities that the Bridge Building Service have found, along with clients, in the local community. The community map enables clinicians to quickly find socially inclusive activities and organisations in the geographical area that their clients are living in. This reduces the amount of time that clinicians have to spend helping people to find organisations or activities that clients might be interested in. And we've generated the community map internally within the Trust. So we know that these places work. We know that clients have been very welcomed in the places that are listed on the community map. The service users really benefit from that because they can have the opportunity to go and do the everyday things that you and I would want to go and do in places that we've found that are welcoming for people who have mental health problems. So we know from the work that we do in the Bridge Building Service that people who make contact and links and relationships in their local community actually end up having less contact with mental health services. So they develop normal relationships in the community with other members of their community, enjoying activities and the social networks that brings. So if we were to win the award, we would like to invest the money in sending our administrator off for some training and using Dreamweaver technology to broaden out the community map so that it becomes something that is developed alongside partnership agencies like Oxfordshire County Council to try to capture all of the resources that we know amongst different agencies. And maybe in supporting service users through service user payments, possibly to do some mystery shopper kind of activity around sussing out some of the places that we think are socially inclusive. I hope you've enjoyed hearing about the community map, and we're very excited about potential developments that this project could have for the future, enabling people to access the sorts of activities that you and I might enjoy during our day-to-day life.